Hi everyone, my name's Eliza. I'm a cognitive psychologist and an ADHD coach and consultant, and today I'm going to talk to you about why SMART goals fall short for ADHDers and alternative goal setting frameworks that we can use instead. So, I'm sure many of you are probably already familiar with SMART goals and maybe you use them in your practice as well. So, SMART goals are often hailed as the gold standard for setting goals. However, there's some newer research that's come out that's shown that there are times where SMART goals can actually do more harm than, they can help. And I know from my own coaching practice, I have a lot of clients that come to me who say that SMART goals just do not work for them. They absolutely hate them, and they often feel really cornered and stressed when they're trying to set, a SMART goal. And so I myself kind of feel similarly, not a huge fan of SMART goals. So if we actually start to explore SMART goals more deeply, though, we can start to see how they might have some inherent incongruities with regard to how the ADHD brain works. And so let's talk about that more deeply. Why do SMART goals tend to backfire for people with ADHD? So let's look at what SMART goals are in the first place. So SMART goals are goals that are specific, they are measurable, they're attainable, they're relevant, and they're time-bound. So there are some other examples, or there's some variations with the SMART goal acronym, but this is the one that I'm going to focus on today. So one example of a SMART goal is I'm going to, let's say my goal is I want to get healthier. So, okay, well, what does that look like? Well, that looks like me working out 3 times a week for 60 minutes for the next month. So very specific in that I'm working out for 3 times a week for a 60-minute interval. It's measurable. I can see that I went to the gym for X number of minutes, X times a week. Is it attainable? Maybe. In theory. Is it relevant? Yes, that goal is relevant to the larger goal of getting healthier, and it's time bound in that, we're doing this over a month, and then it's also bound by the week as well. So on face value, it sounds like, that would be a pretty manageable goal. However, I'm going to talk about why it can backfire for someone with ADHD. So when we look at the actual challenges with goal setting in general for the ADHD brain, we want to talk about executive function challenges. So for people with ADHD, as you probably are already familiar with, they tend to struggle with executive dysfunction. And so executive dysfunction can hinder one's ability to prioritize those long-term objectives over the immediate rewards. So, us ADHDers, we are not waiting for that second marshmallow. We want the first marshmallow, and we want it now. And so you can see how that might be a challenge when it comes to setting goals. So we want to keep that in mind when we are, using any kind of goal-setting framework. And so although SMART goals may work for other people, they don't, in my opinion, adequately address the challenges that people with ADHD face. See, these goals are the SMART goals, they're specific, but what kind of reward is built into them? Like, yeah, completing the task might sound good and we can check off the box, but we need that reward to come closer in time, or we need to make the reward, or we need to bring rewards closer in time, just as one example. So in general, these traditional goal-setting frameworks, like SMART goals, are likely less effective for ADHDers, which can lead to disengagement and frustration. Again, I can't tell you the number of times I've had clients be just totally overwhelmed by SMART goals and try to set them and then throw the goal, totally out and abandon ship. So we don't want that to happen. We want to try and see if we can make goal setting a little bit more palatable for our ADHD clients. So now I want to walk through the specific limitations that are built into SMART goals that ADHDers face. So first and foremost, S for the SMART goal is specific, right? So we want to make sure we're setting specific goals. That is helpful and important when it comes to having a very clear objective. However, if the goal is too specific, it can at some point start to feel very restrictive. And so if a goal starts to feel restrictive, this could reduce one's perceived autonomy. Essentially, this rigid structure is going to limit what they're seeing as autonomous. It's going to feel like they're trapped into this goal. They have to do it, and this can result in a diminished intrinsic motivation. So that inner drive, that connection to whatever the goal was, it starts to kind of sink. It starts to go away, and so this restriction then can start to kick up that don't tell me what to do complex, because the agency in the goal has now been totally eradicated. And so it doesn't matter that the individual is setting the goal for themselves. It doesn't matter if someone else is telling them what to do or if it's themselves telling themselves what to do. They're going to rebel because there's a lack of agency, and then this is going to reduce that intrinsic motivation. So this is a very rigid aspect of SMART goals, which then can obviously exacerbate what we know tends to be the case for people with ADHD already, which is that cognitive rigidity. So doubling down on that, right? So if we have to have a very specific goal that we're setting, that means we have to have a rigid definition. Again, ADHDers tend to struggle with black and white thinking. They tend to struggle with cognitive rigidity. And so when we have an overly specific goal, that in theory can double down on that challenge. So there's only one definition of success. And so with that being said, that could cultivate some perfectionism. And so again, people with ADHD tend to like to set big goals. They want exciting, they have a zest for life, and so they're gonna set these, go big or go home goals. And so again, there's this perfectionism at play, there's this kind of drive for big aspirational goals, and so that together makes it difficult to kind of identify what an achievable goal is. And again, you have to pick one metric of success here. And so then they double down on this perfectionism of like, this has to be the perfect goal, this is what I'm doing, and I will accept nothing less. That exacerbates black and white thinking, cognitive rigidity. When the inevitable happens, which is the goal was too hard to be able to actually meet it, and again, trying to meet attainability, right, in the SMART goal framework, by having one goal that captures that, setting us up for failure. So then we come up against the low frustration tolerance. So we messed up, we didn't hit the goal perfectly, we had to hit it perfectly, otherwise it's not a success. That's, defeating. That diminishes motivation. We abandon ship, and then we go back to, we come back to this frequent narrative of I never follow through on anything. So that then contributes to the same shame cycle, and then contributes to the goal avoidance cycle. Next, we have the R in SMART goals, relevance. So relevance falls short. It does try to make sure that the goal is relevant to one's interest, which obviously is important, but it really falls short because it's really just assessing, is this goal statement in line with this general goal that I want to make, progress on, of like, for example, I want to get healthier. So if I exercise 3 times a week, that is relevant to, this goal of getting healthier. But does that really tap into what matters for that person, for that ADHDer? And the reality is that's not enough. SMART goals don't adequately tap into assessing that interest, that intrinsic connection to the goal. And that is crucial for the ADHD brain. The ADHD brain is an interest-based, brain. It's an interest-based nervous system. It operates on stimulation. It operates on interest, passion, all of those things. And we want to make sure that a goal is actually, assessing for that. So essentially, if the goals do not connect to what the individual is really interested in, it's going to be hard for them to stay motivated and follow through. And so sometimes a goal can seem like it's relevant, as I mentioned, exercising 3 times a week. Yes, that fits with, I want to be healthier. That's relevant. But is that actually more of a should goal rather than a want goal? And if that's the case, it's not going to facilitate goal pursuit or goal attainment. So we really want to be cognizant of whether or not this goal is capitalizing on the interest-based nervous system that ADHDers have. Next, where it falls short is in context and in support. So specifically, when we look at setting SMART goals, it does not take into account how familiar that individual is with the domain that they're setting the goal in, and it doesn't really take into account whether they have any kind of experience where they are in their goal setting journey with this particular goal. And so this is really important because where you are in the goal setting journey, how much familiarity you have with this domain is going to be important when determining what kind of goal that you should set. So we can set process-oriented goals or outcome-oriented goals. There's other goals as well, but these are the two I want to zero in on. So process-oriented goals are exactly what they sound like. They focus more on the process, the journey. It's more on skill acquisition and discovery, whereas outcome-oriented goals are very much focusing on the execution of something. So, for example, I will finish writing this entire code versus I will spend some time exploring how to write the code, or I'll take 20 minutes to see how far I can get in writing this code. So again, it's with process-oriented goals, it's focused on the journey. Outcome-oriented goals are focused on the final product, the execution. And so when you're first starting out and you don't have a lot of familiarity, there's a lot of complexity and not a lot of understanding quite there yet. If you try to set an outcome-oriented goal, you're setting yourself up for failure. So in that case, we want to set a process-oriented goal. And SMART goals don't account for that at all. Next, SMART goals don't have feedback opportunities built into them. And feedback is so important for people with ADHD. Feedback provides clarity, and a lot of times procrastination is a result of ambiguity. So having feedback opportunities, positive feedback, constructive feedback, all of that is going to help someone stay on track with their goal. And it's also going to be motivating, especially when it's positive feedback. And we know people with ADHD thrive with positive feedback. As Ned Hallowell likes to call it, recognition, success, euphoria. And so if we can make sure that that's built into the goal setting framework, that we can build those systems in, so having feedback loops and reward structures, that's going to help with sustaining motivation and momentum to move toward one's goals. Additionally, SMART goals do not take into account the environmental factors that would promote success within an individual. This is really important for people with ADHD. We know that ADHDers are more heavily affected by environmental contingencies than those without ADHD. So whatever goal setting we're engaging in, we want to make sure that we are taking into account any environmental modifications that an ADHDer might need to increase the probability of achieving that goal. So the question of the hour, or the 45 minutes here, how can we adapt goal setting strategies to better suit individuals with ADHD? And so that is where the DREAMS framework comes in. So I developed this DREAMS framework based on what I was seeing in my practice, based on what we know about executive dysfunction in individuals with ADHD, and based on some of the newer research that's come out that's shown that a self-determination theory approach toward supporting people with ADHD might be quite beneficial. And so this framework integrates all of those things to better support goal setting approaches for individuals with ADHD. So let's take a peek at what each letter stands for in this framework. So the DREAMS framework stands for D, domain familiarity. So are you familiar with the domain in which you're setting that goal? Do you have experience? What ambiguity exists? What do you already know? R is for range of success. So to override those challenges with overly specific goals from the SMART goals framework, we have specified degrees of success that we set out in front of the goal. Next, we have the empowerment and agency check. So whatever goal you have set, Does it cultivate agency and autonomy within you, or does it feel restrictive and obligatory? Does it feel like a have to and a should do versus a want to? Next is awareness of gains and losses. So we want to really capitalize on that interest-based nervous system and appropriate urgency. What do you stand to gain by setting this goal and achieving this goal? But more importantly, what do you stand to lose by not pursuing this goal? Next is modifying the environment. After kind of running through D, R, E, and A, we're in a better position now to think about the strategy, the environmental approach to making this goal happen. So what can I do to change my environment to support pursuing this goal? And then lastly is support systems that are outside of like the structural environment. So this is like setting up those feedback mechanisms or feedback loops, setting up that reward system, and then also maybe leaning into your social support system to get additional, accountability. I like to call it support, which also is which also pulls from the self-determination theory of intrinsic motivation. So, the dreams framework starts out with D, which assesses that domain familiarity. So, this is going to emphasize aligning the goal type that you set with the experience level that you have or the stage that you're in the goal setting journey. So if you are just starting out and it's a domain that you've never been in before, there's a lot of ambiguity, there's a lot of complexity, we want to focus on setting a process-oriented goal. And again, this is going to be a goal that is more focused on the process and the journey. So it's more exploratory, and you might set a goal like, I'm going to explore this, writing a section of this book and see where I get. I want to focus on maybe developing the idea and see where I get, opposed to setting an outcome-oriented goal, which is beneficial if you have more familiarity in the domain. It's very clear what you need to do. So maybe it's saying, I'm going to write this one chapter. You know how to write a chapter. You already know what you want the chapter to look like. All you need to do is execute. So that's a case where an outcome-oriented goal might work. So again, the D for domain familiarity is a check, like how familiar am I with this domain that I'm setting this goal in? And then based on that information, should I set a process-oriented goal or an outcome-oriented goal? Next is R, which stands for range of success. And so range of success is essentially what I call a gradient goal. And so for the range of success, we are in advance setting different tiers of success that someone could achieve. So we're establishing like the minimum progress they'd be happy with, what would be the next best progress, what would be target achievement, or what would be the aspirational. So that's that big badass goal that they would want to achieve. And so when we set goals up like this, it provides the opportunity to still allow for that aspirational thinking, because we're never not going to be ADHDers. Like, that's just who we are. We have a zest for life. We like big and bad. And so we don't want to cut that out from our clients, because that's a part of who they are. So when we set up a goal using the gradient goal system in the dreams framework, it still allows the client to be that big dreamer, but then also allows for easier entry points that they set in advance. So it helps with combating that cop-out feeling that they might experience when we ask them to retroactively identify progress and success. So this allows for a more flexible framework, and it can help reduce all or nothing thinking and perfectionism by getting in front of it. Next is empowerment and agency. So this component of the dreams framework pulls from self-determination theory, which argues that when we have these three basic psychological needs met, we are naturally prone to growth and flourishing. And so one of these needs is autonomy or agency. So feeling like we're in charge, we have a choice, we're in control. So when setting a goal, we really want to gauge for this. And that's where the empowerment and agency check comes in. So whatever the goal is, we really want to start to ask, like, does this feel like a should goal, a have to goal? And if that's the case, what do we need to do to shift the narrative to it feels like a want to and a choose to do this goal? If that's not possible, we might need to set a different goal. But essentially, we really want to check, does this goal make you feel agentic? Does it feel like a choice? Or is this goal feeling obligatory? If that's the case, it's going to cut off that intrinsic motivation. And this is especially true for people with ADHD. We want to make sure they feel agentic and empowered. Otherwise, we're going to kick up that don't tell me what to do complex, and then we're going to throw everything out the window. Next is A, which is awareness of loss and gain. So we often talk a lot about reframing negative self-talk, which is hugely, hugely important. I don't want this message to get lost because it is very important to recognize positives. However, one of the things we know from the literature is that brains are more motivated by potential losses than they are by potential gains of equal value. So this is not to say that we want to like stress everybody out and be like, well, if you don't do this, the rest of your life is over. Not what we want to do here. Instead, we want to take a dual motivation approach where we assess both the potential loss, but also the potential gain. So when setting this goal, really thinking about it, like, what do you stand to gain by setting this goal? But what do you stand to lose by inaction? Like, if you don't set this goal, like, what does that mean for you? And that can be a really powerful question to kick up urgency. Again, ADHD is a stimulation brain, an interest-based nervous system. It thrives with stimulation. So if we compare this, the loss aversion, what you stand to lose, but also with what you stand to gain, this can set up a powerful dynamic where we're running toward our potential gains and we're running away from a loss. So we are making sure that we're not losing out on an opportunity. Next is modifying the environment. So once we're able to get through some of the earlier components of the acronym, we're setting the right type of goal. We have different degrees of success for that goal, and we've really tapped into the intrinsic motivation behind the goal. Do you feel empowered? And are you aware of what you're standing to gain and what you stand to lose by not acting? Then we want to talk about modifications to the environment to increase the probability of that goal being achieved. But we can't get there until we make sure that the goal that's set is the right goal. What I say to my clients all the time is that it doesn't really matter what the strategy is. It matters why you're setting the strategy in the first place. Because the reality is you can bring a horse to water, but you cannot force it to drink. We really want to figure out what's going to get you to drink. And so those earlier components help us get to that point where we could get you to drink the water. Now we want to make it even easier for you to drink that water. And that's where the environmental modifications come into play. So what this can look like, it's going to be different for everybody, but some examples might be having more visual cues. That's really externalize, the goal itself. I often hear from my clients, they forget their goals. I'm guilty as charged as well. I write down my goals almost every day because it's easy for me to forget them. So making sure that you have external reminders of them in your environment. Also having, strategic placement of items that are related to the goal. So if, you're exercising, that's one of your goals. Having your gym clothes where you can see them. Maybe having your sneakers, right outside your bedroom door. Just some simple examples there. And then also just reducing any friction toward the goal. So make it as easy as possible to do that goal. And then whatever are competing things for that goal, make it really hard to do those things. But again, we want to just increase automaticity. We want to reduce any cognitive burden because again, with ADHD, we have lower frustration tolerance. So if it's hard, we're going to be more likely to abandon ship. So make it as easy as possible and structure the environment to kind of corral your behavior into what you want it to be doing. Next is support systems. So we want to make sure we have external scaffolding that will enhance motivation and reinforce progress. And so what this looks like is making sure you have regular opportunities of feedback mechanisms. So asking your clients, well, how will you be able to kind of track your progress? How will you stay on top of how you're doing? What can that look like for you? And so some examples here, sticker charts are great. I have so many clients that love doing them. Sometimes they have the scratch off ones and they're able to see like all that they're done. That's super helpful because with ADHD, we are very prone to forgetting, what we did 5 minutes ago. And now you're asking us to remember what we've done in a week. as it relates to like moving toward a goal. So if we can have a way to externalize that progress, that feedback opportunity, that's super helpful. This can also be like meeting with a coach or meeting with a loved one and kind of just taking stock together. I do really recommend like having some kind of externalized notebook. Maybe I'm a big fan of Notion, and having like a tracker where you can put your wins in there so that you can then go back and look at them. Accountability partnerships, so body doubling is a great one, but it's also really helpful to have other people who are in it with us. And I mean like down to the nitty gritty. So again, this can be a coach, but this could also be a collaborator or a loved one. I know a lot of my clients have said they do a lot better when they're working with someone else, when there's like kind of a team aspect to it. And this may have to do with what we know with self-determination theory, the basic psychological need of relatedness. So having people in our lives that get us, who understand us, that is a source of support and motivation. So, having that choice, the autonomy, having related people who get you, and then also if you feel like you can do it, so competence, those three basic psychological needs, when they're met, we're more likely to flourish and have greater motivation and stronger intrinsic motivation. And then lastly, celebration systems. So this kind of goes back with the feedback aspect too, but we really want to make sure you stop and smell the roses. It's very easy to get on that, the treadmill, right? And just keep going and going. We're always looking up, but never looking down at how far we've come. So making sure there's opportunities for that, and also building that in with your clients. So how will you, track your progress, but also how will you celebrate your successes? What will you do to pause and make sure that you acknowledge how far you've come, not just how far you need to go? So let's walk through a quick example using Nina. So hypothetically, right, we have this client, her name is Nina. She comes to you. She's an expert in her field of philosophy, and she wants to write a book. And so she says to you, all I know is I want to write a book. I have ADHD and SMART goals never work for me. The SMART goal that she set in the past was write a 60,000 word book in 6 months. Okay, so that's a very clear SMART goal. We have specificity there. It's measurable, attainable. That's up for debate, right? Relevant, she wants to write a book. This is the way that this can happen. And then obviously time bound, 6 months is that time frame. However, we know that this doesn't work for her. It totally butts up against her ADHD. So let's walk her through the dreams framework to help her set a goal that might work better with her brain. So Nina has never written a book before. This is her first time doing this. So walking through the dreams framework, starting with the domain familiarity aspect, we want to match the goal type to her experience level. So there's a lot of ambiguity. She's never done this before. She has no idea what it's like to write a book. So instead of focusing on an outcome-oriented goal, which is actually how the SMART goal is framed of write this book, let's focus on the process and set a process-oriented goal. So let's start with exploration. Dedicate a few 1-hour blocks to working on the book and see where you get. So working on the book is loose. It's not overly specific, but it's loose enough that there's an exploration aspect to it. So maybe what it means to work on the book here is that she's brainstorming ideas, or she's brainstorming potential chapter ideas, but it's not so focused on writing the book itself. It's on the process of what goes into writing the book. So now that we have set more of a process-oriented goal with Nina, let's really assess the range of success application. Let's try to move this to a gradient goal, because Nina's a perfectionist. She's an all-or-nothing kind of gal, and so if we can get in front of that, that can set her up for more success in terms of maintaining her momentum. So originally that goal is, let's do you need to write 1 hour, you need to work on the book for 1 hour a few times this week. Okay, well, what would be the best case scenario here, and what would be the worst case scenario, or the minimum progress you'd be happy with? So best case, Nina says, I want to do 3 1-hour blocks of working on the book. That would be awesome. If for some reason that couldn't happen, then the least that I'd be happy with is 1-hour block of writing this book or working on this book, right? So the original way it had been set was very much all or nothing. Like I either have to, write a 60,000 page book in 6 months, otherwise it's a failure. And so when we dialed it back to a process-oriented goal and made it focus on like, okay, let's explore what writing looks like, and we'll dedicate some time this week. And then we took it even further to identify different tiers of success. So anywhere she lands in terms of working on this book for 1 1-hour block to 3 1-hour blocks is going to be a success. So it provides easier entry points, but also allows her to have success points clearly identified in advance instead of trying to do that retroactive progress identification, which often backfires because they're like, well, this is a cop-out. So let's get in front of that. Next is the empowerment application. So again, assessing for agency and choice. So Nina brings this goal to you. We've come up with a process-oriented goal and ranges of success. Now let's really gauge, like, does this goal feel like a choice to you? Like, does it make you feel agentic, or is it making you feel obligatory? So really kind of uncovering what's driving this goal for Nina. And so maybe at first Nina was feeling like she had to write this book because that's what her colleagues were doing. They are putting, publications out there, and that's what you do in your career. You should be writing. And so if you're hearing that kind of language, really getting curious with her and asking like, okay, well, I'm hearing a lot of shoulds and have tos. Like, it sounds like this feels like an obligation. And, maybe even being curious and asking like, what do you think would make this feel like a choice to you? And so if we're able to get to a place where the book does feel like a choice, it's empowering, it means something to her more than like it's what you should do, then maybe this is likely potentially a good goal for her to set. But if we can't get past that and it's really just being driven by a should goal, then maybe this isn't the right goal for her. But for the sake of simplicity, let's say this really works out for Nina. And what comes out in our exploration is that she wants to write this book because she values sharing these ideas, and it's going to be a powerful experience for her to do so. This feels like a choice. It makes her feel free, opposed to it feeling like an obligatory thing for her. All right, now that we've gone the empowerment route for agency, we want to look at what do you stand to gain. So this starts to kind of capture the urgency side of things, and hopefully in a healthy way. So we want to really assess for what do you stand to gain by pursuing this goal, but also what do you stand to lose by not pursuing this goal. So if we can incorporate both loss aversion and gains, this could start to harness motivation in a dual approach. Like, it's not just about making someone anxious, like we don't want to do that, but it's really about helping them see like this is a missed opportunity, and making sure, again, if this is the right goal for them, it really will be a missed opportunity if they don't take action. So it's kind of galvanizing that it's now or never feeling, and getting people excited and wanting to pursue that goal. So again, this idea of what do you risk by not writing this, and then what do you gain from writing this book? And so for Nina, if she doesn't write this book, it's a missed opportunity to share the ideas for with the world. It's a missed opportunity to help other people. It's the right time for her to do it. And what she gains from completing this book is she gets to share her ideas. She gets to check this off the list for accomplishments in her life, which is something she's always wanted to do. So again, it's kind of tapping into both this positive and also a little bit of, not necessarily negative, but a little bit more urgent kind of motivation. And so one way to think about this too, in the short kind of form, is we want to be running toward our goals and away from our losses. So now let's look at the environmental modifications that we could take. So Nina set the right goal. We have a process-oriented goal. We have a couple different tiers of success. It's an agentic goal, and we've identified what she stands to gain and what she stands to lose by not doing this. And so now we want to assess, okay, what's the kind of environment that Nina needs in order to be successful? So normally, when Nina didn't have a dedicated space, she knows that it was really easy for her to wiggle out of writing. Even though she wants to do this, it's an important goal, but when the environment wasn't set up in a way that corralled her into writing, it was easy to kind of wiggle out of it. So maybe what we're doing here is we create a specific writing area. We make sure that her files are very easily organized, so it's easy for her to get started. Maybe we also have her all of the things she needs ready and out there for her. So maybe before the night before, she sets up her laptop where the Word document is open. So when she opens her laptop, all she has to do is hop right onto it. And then maybe she's also reducing distractions and maybe working alone, or maybe she actually needs to work with other people, and that's a great segue into the supports piece as well. So we want to then take stock of the other kind of support systems in her life. So how are you maintaining progress, feedback? Are there other people who are in it with you? So maybe for Nina, she actually establishes a weekly writing group. She has other people who are also invested in the writing process, and so she's able to kind of connect with other people again, so maybe starting to satisfy that relatedness need. And then maybe she uses like a word count tracker and is able to see how many words she writes in a session and also in a week, and then has a dedicated time to go over her word count accomplishments each week, right? If she's writing words at the beginning, she's doing more exploration, so maybe she's able to kind of track the number of ideas she came up with, or track the number of minutes that she spent exploring what it would look like to write this book, or exploring ideas for writing the book. And then also having built-in opportunities for celebrating her progress. So maybe after the first week of doing all of these writing explorations, she gets to go out and have a drink with a friend, or maybe she gets a cupcake. I know that's my favorite reward for myself. So these things are built into the system. So what the dreams framework does is it shifts this perspective from an overly rigid goal setting framework, from the SMART goals framework, to more of a systems approach. So SMART goals have their place. Not a big fan, but they are a good starting point. And then we can layer in the dreams framework to start to really assess that goal statement and make sure it's a good fit for that individual, and then also build the support around that goal statement, so that we increase the probability of that goal actually being attained. And so, in general, we can just think of it more as a systems approach that allows us to kind of run through a goal, check its feasibility, check if it matches, and then figure out the systems and strategies that we need to put in place to help that individual achieve that goal. And that is what I have for you guys today, and I'm looking forward to your questions. Thanks so much.